back here at Carolina Women. We're at Bluffton Aesthetics. We are with our friend, really like her, Charlotte. She is amazing. Every time we come, we learn something interesting about, and my new word for the day is neurotoxin. And I think it's great. We're going to talk about something you guys, I think, will be really excited about today.
So we're going to be talking about neurotoxin injections in the neck, more specifically the platysmal bands.
All right, platysmal bands. She made me practice that. Did I say it right?
You nailed it.
Okay, so what are platysmal bands and how would a neurotoxin help?
Yeah, so the platysmal bands, there's a muscle that encapsulates the entire neck, and as we get older, they start forming bands.
Okay.
And we do injections into the bands themselves. And it's a wonderful procedure, particularly for aging patients, for a couple different reasons. So I think a lot of times patients do all these injections and good skincare to their faces, and we can sometimes tend to neglect our necks. Yeah. And then we get to a certain age and we're like, oh my gosh, I should have been keeping up with my skincare and routine on my neck as well. So basically what it does is it helps to smooth the appearance of the platysmal bands. So these bands that are just prominent at rest, it helps to smooth those. And then it also can give a lifting appearance to the jawline. Yeah, so the big strong muscles in your cheeks that lift up aren't fighting against gravity, aren't fighting against the strong muscles in your neck, and they're able to lift better. So it can improve jowling and give you a sharper appearance in your jawline.
It's really interesting. So if I came in for a consultation and I said, all right, here's your palette, sort of your blank slate, if you will. Can you advise where you think the neurotoxin would be most effective and almost give me a master plan?
Absolutely, that's what I love to do. I love patients who come in and they have no expectations. They're just kind of looking at me to guide them. That's what I love to do and I'm great at doing. And I think, you know, we always want to focus on what bothers the patient, but if you're looking for my guidance, I'm more than happy to give that.
It's really funny, I've got a couple of folks who go to you and that's what they said your strength really is sort of guiding the procedure and the priority, but also setting up more of a master plan. Because I know, you know, being almost 70, I'm trying to figure out what do I do, how do I be thoughtful in what I do, and what should my expectations be.
Absolutely.
And that's what you said, that neck is sort of a real good one.
Yeah, and I think just like you were saying, we have to prioritize. We can't do it all at once, right? So I think that's a great, coming up with that master plan and deciding what treatment we're gonna do and when, and just so you know what the outline for your entire year of treatments looks like.
Can I ask you about neurotoxins? We chatted a little bit about it. I was curious, neurotoxin is more of an overarching name or a generic name? Exactly.
So it's the category that brand names like Botox and Xeomin that we carry fall underneath.
Okay. And how do certain things work better for certain people or procedures?
Yeah, so as far as Botox versus Xeomin, I think it's kind of like other medications. One product may work better for a person than another product would, but in general, both products work very well on the majority of the population.
I want to go back to the neck for a moment. How often do you recommend you do this? And again, are these treatments that once I have it, it almost is cumulative? In other words, my neck kind of gets better and better, and because it's being held in place, if you will, for lack of a better word, it's sort of...
Absolutely. So I would say specifically with platysmal band Botox, I typically recommend biannually. So when you come in about every 3 to 4 months for your full facial Botox, every other time I would love to add on lower face and lower neck. And that seems to work really well with most of my patients.
And not that I got a little nervous about it, but when I asked, you said from a discomfort point of view, not at all. No one's complained at all.
No, it's honestly, I would consider it less painful than a majority of injections in the other parts of the face. It's very easy, very little to no downtime. It's a great procedure.
I mean, I'm really excited about the potential of that. Again, if people want to come and have a consult, is that recommended?
Absolutely. If you are new to any type of treatment, I always recommend having a consultation first, just so you can know what to expect.
I really appreciate your time, and I think all of they do too.
Come on in.
There you go. Stay with us. There's more to come here on Carolina Women.